What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering the top conflicts and issues you'll find yourself if you work with nurses. I am an Xray tech, and the constant battles of the RT, RN, and respiratory, which technically they're RTT, and we're ARTR. So, battle of the R's anyway. So, mainly with the nurses is the main one. You will consistently have, not really conflicts, but you'll kind of like always be running into each other to try to, do your job and stuff. So some of the issues you find yourself in, especially working where I work at a trauma 3 ER. And majority of the times, they order a lot of chest x-rays, which are our bread and butter of our department, which once again, that takes 30 seconds. If you shoot it one time, in and out, 30 seconds tops. But the problem is, you have the nurses, respiratory, have everyone in your way, but you have 30 seconds of work that you're trying to do. Some of the veteran nurses who've been in the game at your place and kind of understand what's going on, they'll get out of your way. If they're doing something, they're like, okay, shoot it real quick. Because once we shoot it, we'll never see them again. And they're done, and we get out their way, and they can work in peace. Other ones, they'll see you, and they're like, I have them. You're going to have to wait. And depending on what's going on, if they tell you to wait, and you have a bunch of other stuff going on, you're like, okay, just know it's probably going to be another 20 to 30 minutes before I backtrack and come back to him. So if it gets worse, sometimes like the doctors will get pissed because they want to see what's going on. And like, they want to know, okay, does this patient have pneumo? Does it have this? And then they'll call us and like, well, your nurses were in there and they told us to basically leave and come back later. And sometimes, I've only had this mainly in the daytime, where the ER, I'm like, the ER doctor will come and tell like the nurses to get out the way. And it's so beautiful. I feel like a little princess. Because you're like, I'm not going to tell the nurses to get out of the way, but you can, because you're the doctor. So that happens a lot of the times. Other times, it'll be trauma situations, right? Patient, there, trauma. Let's say it's a GSW or something. The nurses are trying to do their job, trying to get blood, trying to do this, trying to do a bunch of other stuff. And you're there, trauma bed, slide the board, get everything prepped, everything ready. And then you have the infamous, okay, we need to shoot this. And then you're like, okay, X-ray. Nurses still don't get it the way. Their hands in the anatomy doing stuff, and you're like, come on. Like, we're trying to get this. The ER doctor's like, come on, I need this. And deep down, because of your alara, because of your ethics, and because of the power you hold in your hand, the dead man trigger, you have to be aware of radiation. Sometimes certain nurses, they don't care. They're like, go ahead, shoot it. Other times, you'll say it so many times, and they'll just be so focused in their zone, locked in, that they won't pay attention. So occasionally, you'll say so many times, you're like, oh, maybe, he wants me to shoot it. And then you shoot it, and then they get pissed at you because you shot it and you exposed them, when you're like, we've told you several times. The doctor told you. I told you. The other nurses told you, and you were still locked in. And I'm like, why are you mad at me when the doctor is telling me to shoot, to get the picture? Because this patient needs either a chest tube, intubation, whatever he needs. He needs to know what's going on. Your blood and other stuff sometimes can wait. I understand, because my lady's a nurse, that their job is important too. She'll tell me all the time, because sometimes I'll ask her, I'm like, oh, what's this? Oh, what's that? And she's like, oh, it's to get this. Or, oh, it's for this. And I'm like, oh, that's very important too. Like, you hold also importance as we do. Sometimes you could say they deal a lot of more of the patient care side. Ours is kind of like in and out, beep, boop type of situation, which is ours is more easier. Because even the documentation, all that, we could do that back in our little X-ray department. We don't have to sit there with every single patient and like document. We could literally quick start, have everything prepped. So literally you get there, introduce yourself, put the board behind them, and that gets a chest X, shoot it, in and out, 30 seconds. that is like the most ideal situation. I would say to avoid some of the conflicts or to make your job easier, you have 1 or 2 situations you can do. If certain doctors, you can kind of tell their workflow and how they order stuff. Some doctors will essentially sit down and they'll just order everything. And so everyone, both you, RN, respiratory, everyone gets their own order spun in. Other ones will slowly throw in orders, so like the workflow will kind of, steadily be getting stuff done and there's no confrontation. Usually that happens in smaller hospitals. We have a smaller branch of our hospital, and over there, usually we don't run into each other because the way they order it is kind of like staggered, so everyone kind of gets everything done and there's not really overlapping stuff. Versus like in the big hospitals where they see so many patients, so much stuff going on, they kind of order it because they'll probably forget. And then that's when you have the conflicts of like everyone bumping into each other. I personally, since I work night shift, depending on the workflow, I kind of will check if the labs got done, if there's a lot of, because sometimes they'll like triage patients because there's not enough beds. So they'll triage patients and throw them back out the waiting room. If you do mobile x-ray and it's just a chest x-ray, you have 2 options. You can either go all the way to the waiting room, bring them all the way back, shoot them, and then walk them back. Or you can, with your portable machine, go into the triage, shoot them, and then just boot them out. And it's, I don't know about you, and maybe it's just a night shift thing, but it's always easier if you can just shoot them in the triage and then throw them out. Or just come to the triage and like knock it out there. It's always like simpler for us to do it that way. I don't know, it's just personal preference, I guess, maybe. But it's always easier, more efficient workflow that way. Unless it's a 2 of you, then you have to kind of bring it back. So sometimes when it's full, it's always like as soon as the order spawns, you're like running to the triage before they'll get booted out. That happens from time to time. If it's like there's a bunch of room, there's a bunch of space, you can either play the waiting game kind of and just wait for them to get sent to the beds, or just kind of let your little order stack up. We kind of found for most nights, certain doctors are different, but for most nights, a little 30-minute kind of window of just shooting and then waiting, shooting and then waiting kind of cycle kind of works very optimal for us. That's what we've recently always been doing. So, but once again, certain doctors are like, we have certain doctors that are more notorious or just like are very, very fast paced, that like as soon as the order come in, if you don't get it done within a set window, like they're more faster to work, or I'm not sure how they do their, maybe the way they do stuff is a little bit different, that they're like so quick to need it. I understand, like if it's a trauma, any trauma, or even if it's a baby, of course you're not going to wait that long because of the level of like priority, and like, sometimes you don't. You just go in as soon as it spawns, you go in. And especially if you have a long list, and even though you look in the ED manager, there's a bunch of stuff, you'll just go, and as stuff comes in, you'll just constantly, like a good steady flow of just shooting stuff. The only issue you'll find yourself in is like when you go and you shoot one, and then you go, and then they tell you nah, and then they tell you nah, because there's nurses, and like you literally run around the whole hospital, maybe there's 10 x-ray orders, and none of them let you do your work. Then you go back and you sit down, and you're like, well, I'm gonna wait. And then they call you, and they're like, have you shot this? Have you done this? And you're like, no, because they're in my way. And then you go and check, and they're still in there. And then you go check, and then ultimately it makes you look bad. So we ended up just documenting a bunch of times that they're in there, and like we explained to them. Most of the nurses, once they are working there for like a good amount of time, or you build a relationship with them, they'll kind of let you automatically just shoot it and then in and out, because they know it's easier like that. Yeah, it's been your boy Miguel. Hope you enjoy this knowledge as I give you the insight of radiology and all the do's and don'ts and the tiny little hidden gems. And yeah, see you on the next one.